So that was for Amy Ainsworth. I am so jelly that you went to Luke Bryan. I hope you had the best time. I love him. Hey YouTube, it's Shanzie Mac. How are you today? I am in my 5th day of liquids and I am crazy, obviously, but I'm hanging in there. So I'm actually going to do a separate video on liquids, so I don't want to chit-chat it up too much, but I am alive and somewhat sane, so yay, go me. So the video I'm going to do today is actually about my pre-op appointment with my doctor, Dr. Kim, in Colleyville, Texas. He's done over 6,600 surgeries. He's considered a surgeon of excellence. He has a very low rate of any complications at all, and he's got a stellar reputation in Dallas, which is why I went with him. I went to my pre-op appointment and I got 2 things. I got a folder with information I'm going to go over with you. This is Dr. Kim and this is Dr. Holden, and then this is the B book. So for all you KBI patients out there, this is the Bible to live by. Over 60 pages, so everything you need to know is in the B book. So read it, read it, read it. What I'm going to go over today is actually just an overview of what my appointments were. I had 2 appointments in Dr. Kim's office. One was obviously my pre-op with his physician assistant, you know, all those types of things. And the other was actually where I got my B book and kind of a general overview of what pre-op, surgery, post-op looks like. With that said, Pam, who is his nurse that held the class, she did a slideshow presentation, and so this was kind of all of her bullet points, and we'll kind of run through those because there's a lot of good information packed in there. As well as something I really appreciated is they gave a list of all of the providers, nurses, physicians, assistants. You know, a lot of doctors and practices don't do that, and someone else new comes in your room and you're ill prepared. So I appreciated the fact that they actually documented it, who they are, and gave some background on them. This is actually a diagram. I'm going to hold this up a little bit of what a normal stomach looks like and one with a hiatal hernia. So whenever they did the scope, I had the hiatal hernia. So they went into that they'll go in and repair this whenever I actually have my sleeve done. Okay, we got to taste. He requires that all of his patients be on Berry Essentials protein powder. I'm a week. Everyone's kind of, some people are 2 weeks, 3 weeks, a month. I think it really depends on where you are in your journey, how much weight you want to lose, you know, what your medical conditions are. So mine's 1 week. But one thing they did is they actually did a Berry Essentials protein shake kind of recipes so that you could mix it up. Sadly, I'm kind of one of those people that I find something and I just do it. These were some reminders before surgery, things that no, you shouldn't take as far as medications, diet pills, birth control, steroids, antibiotics, and then allergy medicine. This one I was super excited about. This is a 2-month calendar, and it starts on your surgery date. So obviously I do liquids 1 week prior to surgery. And then 1 week after surgery, I continue clear liquids. And then here is full liquids. Protein, I switched to my own protein drinks. Here I can continue full liquids, and I can add in cream soup. Then you go to your pureed foods, baby foods. And at this week, which is week 5 after surgery, they want you to be at 1 mile and walking. So I'm going to try to actually beat that out. So we'll see how that goes. Then you continue with your protein diet to soft foods, 2 weeks here. And then this week 8 after surgery is when you actually start to progress to regular foods as tolerated. You definitely want to take that slow. I thought this was very helpful. I'm a planner. I work in arts and events in downtown. I plan out all my meals. It's super helpful. So if anybody wants a copy of this, I'll be more than happy to copy and scan it and email it to you. Just, you know, shoot me an email, ShanzieMac@gmail.com, and I'll be happy to do that. They did have me sign a consent. I think everyone before surgery kind of has to sign their life away, and you know, it was a requirement. And we also had to pay for our surgery. If you're self-pay, which I am, that all of that was paid, or that your insurance, if you're blessed enough to have your insurance pay for it, that all of that's taken care of. Review of the actual bariatric university overview. It was a review of the operation, the risks, the benefits, the hospital experience, nutrition expectations, activity expectations, and medications. And obviously the benefits are that you get to live longer, you have, you know, huge weight loss, up to 10 pounds or more a month, which is awesome. This is something I really appreciated, was the risk. I mean, obviously we had to do the consent form, but it talks about that, you know, this is a surgery and there are risks, and it could be anything, a myriad of things, and it could be intensive care. And you really have to be prepared for the worst and hope for the best with this surgery. But there are risks and they should be considered. So please, please look into that. If you need some of this information, I'll be happy to pass it along. Obviously, the gastric sleeve is a restrictive operation, not reversible, will hold about 3 to 4 ounces or half a cup. And the sleeve, how they kind of gave the analogy was, your stomach is the size of a football, and then after the surgery, it's the size of a banana. You have to prepare for the surgery, obviously, which is where I am with my liquid diet. You have to stop carbonation, stop smoking, and you have to practice chewing 25 times before swallowing, which I can't really do. I'm chewing sugar-free gum right now just to have a chewing sensation, and I'm also doing popsicles and those types of things just to chew, because you really do miss that chewing sensation when you're just doing liquids. To stop drinking 30 minutes before a meal and 30 minutes after a meal. So this is something I'm really going to have to work on. Drink when I eat. Liquid diet ordered specifically for you by your surgeon. I want you on 800 calories a day, 4 to 5 meals mixed with water, skim or 1% milk. Expect to lose 5 to 25 pounds during your liquid diet. It's going to clean out your system, so be prepared for that. It's going to clean out that colon for sure. You can have unlimited 0-calorie drinks. So that was it. And you can have 1 cup of low-sodium chicken broth a day. Day before surgery, you definitely want to be well hydrated, because they're going to be trying to get an IV on you, and if you're dehydrated, they're going to have a really hard time. Require me to take a Pepsid the night before surgery, to wear something comfortable to the hospital, to shower in an antibacterial soap that I showed you on the hospital pre-op video, and nothing to eat or drink after midnight. Day of surgery, obviously you have to shower with that antibacterial soap again. Follow whatever instructions your doctor gave you. If you're diabetic, you can't really take your medicine the day of surgery. They want you to come in 2 hours prior, do your IV, give you an antacid and any antibiotics. They're going to give me an injection of heparin in my stomach. So we'll put compression devices on my legs for blood clots and just keeping circulation going. And then the surgery will take about 45 minutes to an hour. And then the recovery time is about an hour to an hour and a half. And then after surgery, I'll be given water if I'm not nauseated. I may be able to drink 30 milliliters of water every hour. My stomach is going to be swollen, and the liquids aren't going to go down that easily. So each day you'll advance your water and fluids. As far as pain goes, obviously they're going to have an IV pump. And they'll also do a block in your back to help. I've got a hottie batati anesthesiologist named Dr. Johnson that I am excited to see again. Lord have mercy. We'll have pain on your left side where they take out the large portion of the stomach. And it's usually sore for about a week, but I know a lot of people online that are sore longer than that. And I actually had a friend of mine I recently met at a support group suggest getting a belly band. You can get them at pharmacies, and they really do help with that side pain. Obviously, after surgery, I showed you the calendar, 3 weeks of liquids after surgery, then 2 weeks of pureed food, and then 2 weeks of solid food. It just kind of goes through the different foods you can have, shopping list, and then obviously a progressive diet slowly after surgery. This is actually a discharge after surgery, and it has some really good information, plate portioning, and then if you're out and you can't carry your plate, handy portions. It kind of goes through all of the hands and how to tell different sizes and portions for food. You want to get active. The main thing looking at this is walk, walk, walk. No driving when you're on pain medicine. Can't shower till 3 days. And you can remove the dressings 3 days post-op, which I don't know about all that. Probably going to have to do some no water shampoo, like the dry shampoo, because I'm going to be doing videos and I don't want to have like yucky hair. You can't take a bath for 2 weeks. You can't submerge your incisions in water. And then you have obviously a follow-up appointment, or I have a follow-up appointment with my doctor about 10 days after surgery. Excessive nausea, vomiting, worsening pain, temperatures over 101 are not normal. So if any of that happens, I'm going to have to call the doctor. And then the goal is to walk 30 minutes a day to gradually work up to more and hopefully add 10 minutes 3 times a day. That's pretty much it in a nutshell. I know I talked really fast. I hope that it was a quick and good overview for everyone out there. If you have any questions, certainly leave a comment below. If you have any additional questions about the B book, certainly let me know. Or if you want a copy of the 2-month calendar, I'll be happy to send that to you. Hugs and kisses. Mwah. Till next time. Bye-bye.